And Shari, like usual, has sent me a document full of questions.
Yeah. I was just telling them as you came onto the screen and drew all of our attention away from anything else we could possibly do today with that wig. But there's a link in the post. You need to just click the link. That will help you. That will get you entered to win the pump. And it'll also give you some videos and some great information about the Evenflo products. So make sure that you click through later. You don't have to do it now.
No. Oh, speaking of data and the pinchers of power, I hope somebody gets that reference. Polly has a question, and it involves teeth.
Of course.
It's not biting.
Huh?
My little one has had his first 2 teeth pushed through, and it seems to have altered his latch. He's not biting, but the latch is really uncomfortable no matter what position he latches from. Any tips?
Yeah, teething is such a, it obviously happens while you're breastfeeding because it's the same timing. You're breastfeeding and the baby starts to develop teeth. Some people do experience biting, but sometimes it's not biting. It's the way they're, like she's explaining, the way they're latching is they're trying to latch the same way as before, but the teeth are kind of in the way. And so some moms will feel like a rubbing sensation of the teeth. It's a very similar answer that I give to when moms are having biting, and it really has to do with making sure you don't get too lazy with your latch. As babies hit a certain age, we can get a little lazier with the latch. Nipples are a little bit more used to it, and so you don't really pay too much attention to how close you're holding the baby. But I would just, as they're teething, as their teeth are coming in, pull the baby closer to you, angle the head a little bit more, pull the baby in more. What it does is it essentially has them open their mouth wider. And so when their mouth is open wider, there's less biting down, and there's also less scraping of the nipple between the teeth. Beyond that, you could try different positions. Sometimes it's just a position change that can help. And don't wait until the child is super hungry. You shouldn't do that anyway. But try to keep offering the breast so that they're not feeling too hungry when they latch on. It can make them suck a little too hard, and that can be a problem with the teeth coming in. And then take them off as soon as the feeding's over. You might want to use this time while they're teething to not keep lingering too long, because when they're done, they tend to clamp down a little bit more.
Very good. Very good. We actually have quite a few questions.
There's so many questions. And a lot of these actually came to my private group too. There's just so many people asking so many questions, and I figured let's just start answering some of them.
It's very hard. What I forgot existed for about a week and a half, and I normally am very good about checking it. My wall. I had not looked at my wall.
People posting on your page wall.
Yeah, on the post on my page wall.
I'm guilty of that too.
Because what I hate, let's just talk about technology for a second.
I'm having a really hard time taking you seriously though with that wig on. It's distracting.
Listen, does Brant have braces? No, he must have been standing in a hole. He's shorter than normal. So with the Facebook app, and I'm sure you can relate to this, it's I wish there was a section in the app where you could just hit wall and it would be right there, and there's not. Mm-hmm. And it is such a pain in the butt to go look at the wall in the app. And I wish there was an app just called Facebook Wall, to be honest. Even if it had to be a separate app.
Are you using your Facebook app or are you using Pages?
I use both.
Okay, in Pages, right above your first post, it says post to wall.
Yes. But it's I need it to be easier.
But it's not real obvious to see.
No.
It kind of blends in. I know the feeling.
And sometimes I use the Creator app, and the Creator app is different. It's all just a mess. But yeah. Oh man. So Whitney has a question. Whitney Rodriguez. Are there ever any instances where one twin will breastfeed and one won't, so it'll have formula?
Well, definitely you can have one twin that is maybe struggling with latch. while the other is not. Two individual babies can be having individual problems. So it's not that the baby necessarily won't latch, you just may be struggling more, and it would be a good time to see a lactation consultant and get support with the second twin. I'll talk a little bit more about that piece of it, which is, you know, so many moms are encouraged from the first day after their twins are born to try immediately to latch both babies at the same time. It will definitely be easier later, and it'll definitely make the time go quicker. But what I find is that it's an advanced skill, and sometimes not the best thing to do right from the first day. I would recommend that if you're a mom of twins or more, that you try to latch each baby separately in the beginning, so you can really pay attention to your latch and your hold. We have a dominant hand, you know, so sometimes it's easier for mom to latch on one side versus the other. It may not be the baby at all, but just putting the baby on that side that you're having more difficulty with. You need both hands in the beginning. And I want moms to get the feeling of what it's like to get good positioning, one, to prevent nipple soreness, two, to make sure the baby's, you know, transferring milk as effectively and as efficiently as possible, that you're getting the best latch. And that you can hear that particular baby swallowing so that you can know milk is going down. It's just a better option from the beginning. And once you're sure that everything's good and the latches are good and the babies are gaining weight and there's no problems, then you start to do more of a tandem nursing with them where you can latch them both together. And I think that's really important if you're having one baby that's struggling with latch. Don't try to latch them at the same time as the other one. You'd actually, most moms of twins that I talk to about this and recommend this to, they wind up saying that the feedings actually go quicker when they nurse each separately than when they try to do them together as newborn.
Really?
Yeah, because again, the better the latch, the more efficient the feeding. And so if you're really focused on one and you have your hands free for that baby and you can hear the swallowing, you can, you know, stimulate them to keep sucking, that's going to make the feeding go faster than if you put them both on and you're really not able to manage the feeding.
Yeah.
Later for sure, you want to do them both together as if you can. And if you can't, it's fine.
Jennifer was pretty lucky. She pretty much did a double latch from the beginning and had no issues.
And it's not an absolute for all people. It's not an absolute for all. It's just, you know, that's been my experience that most moms do better with doing one side at a time, one baby at a time to start, and then ease into tandem feeding.
Yeah.
Mm-hmm.
That's very good advice.
And get a lactation consultant and reach out to someone right away. Okay, if one baby's to the point where they can't latch and they're being formula fed, and that's not by choice, but you're actually just feeling like you're unable. If you're choosing to do it, then that's one thing. But if you're feeling like you just can't, then you need help. And the sooner the better, because the longer you wait, the harder it's going to be to get that back. Plus, you want to maintain a double milk supply, you know, so you really do need the other baby to be extracting milk so that your supply keeps up. And so I would say as soon as possible, get help.
Awesome.
Mm-hmm.
Angelina has a question, and I know we talk about this somewhat frequently in here, and I know you and I discuss things like this a lot privately because we talk about things.
Yeah.
Angelina has a question. My daughter, 3 months old, sleeps straight through the night. Should I wake her up so she can eat?
3 months old?
Yeah.
I would say at this point, no. If the baby at 3 months old is sleeping straight through the night and doing well, and I'm assuming eating well during the day, I'm going to say all these things, assuming these are the things you need to be making sure that are accurately happening, that they're gaining weight appropriately, that they are peeing well and they're hydrated, the baby's satisfied, obviously, because they're sleeping through the night and eating well during the day, then no, some babies can go through the night, and it's something you don't need to do by 3 months old. Be happy, sleep, get your sleep, and allow your supply to adjust to the baby at that point. You don't even need to get up and pump. Your milk supply will adjust to what the baby's actually eating, and that's the normal progression of breastfeeding. That, you know, eventually they will start to sleep through the night. Some sooner than others. Some will take years. All normal and all fall within a normal range. So no, don't wake them up. Don't wake them up.
Yeah.
A baby that's hungry at 3 months will wake up.
Yeah. So my best friend Brian and Amy, you know, I was just up at a wedding upstate, and so they have a little nugget, and Dean is about 4.5.
Yeah,
and he's
so cute.
Oh, he's the best, and he is properly sized. We will leave it at that. His thighs, I did not understand the full scope of them until I was changing his diaper, and I took that onesie off, and I was like, well, hello. But he's been sleeping through the night, like, for a couple months now, no problem. And all his diapers are great. He's gaining weight. Like everything's kind of adjusted, and like.
But maybe it's so great. It's such a perfect example because here he is, he's sleeping through the night, but he's obviously gaining a lot. He's big. So why do some children need to wake more frequently or eat more frequently while others are able to go longer stretches? You know, there's different reasons, but the main reason I think we should address, because maybe you're watching this right now and you're saying, well, it's not about sleeping through the night, but I have to feed every 2 hours. Why is my neighbor feeding every 4? You know, how do I get them to go longer stretches in between? And that really has to do with your breast capacity. And we've talked about this before, Jamie, where it's like, you know, some women just can hold more milk in their breast than others, you know, so you make more, you hold more, the baby can go longer stretches. That's not for everybody. For some women, you need to feed every 2 hours so that the baby's getting the right amount of volume in a 24-hour period. But if your baby can go 4 hours and that's working out fine for you, and again, this is not newborns. I would not apply this to the newborn stage, but you're saying 3 months, 4.5 months. If they can go longer, great. If they can't, that does not mean that you have a low milk supply. It just means that with your breast capacity, you're just going to need to feed a little more frequently. And overall, babies take approximately about the same amount in a 24-hour period. So you're looking at somewhere between a 1 ounce to 1.25 ounces per hour. All right. And that'll also answer anybody else's question if you had about like, how much do I leave for my baby if I have to go out, you know? 1 to 1.25 ounces per hour is the average amount. Calculate that out, see how often they're feeding, how frequently they feed, calculate out what you think they're eating, if it's about that amount, and feed them that. If you can't pump that amount, then probably you need to pump more frequently.
Yeah. And Amy has a pretty good stash in her freezer. So I got a lot of time heating up the milk and doing the bottle feeding.
That's awesome.
And obviously, you know, I sent her, you know, the Evenflo pump. She uses the bottles. She has a multitude of bottles there, you know, because I think like everybody kind of plays with them. And so maybe for different bottles on different days. But I always use the Balance Plus with Dean. Because obviously I've used it with babies before and I sent it to friends and whatever. But for my job being what it is, I don't get to play with little fresh babies that frequently.
Yeah. Yeah.
And it's like, just being able to hang out with him and like dump the milk and like put it in the bottle, watching his lips and his open flange and latch on that nipple was so good. Yeah. It's like you didn't have to alter it at all. Yeah. It was crazy.
It's great when you can make sure that and you're pointing to something that's so important, like if someone else is feeding your baby or you're even using bottles to feed, to make sure that you're trying to keep that whole experience as much like breastfeeding as possible. And what I mean by that is not just about how they're sucking on the nipple, but a comfortable latch onto it, but also pacing those feedings and making sure that you're doing it slowly and that you're stopping frequently to give the baby a break to.
I sure did burp him. I sure did burp him.
Hope you burped him the way you're supposed to.
Sure did. I was trained properly.
That's right. That's right. How many of you guys know my burping method? Have you used the burping method? So many people. That video just keeps on going and going. I've got like 4.5 million views on that video, and people are like, "Oh my God, burp just comes right out." Yep.
He's at that age where like you don't have to do this anymore. So I boosted him up just a little on my shoulder, like under his sternum, and he was like, "Ah."
And it sounds like he's too heavy to do that anyway.
Yes, he is, because his thighs.
It's on the thighs.
Like,
I kind of understand that.
woo, woo. Come on, Face ID. With the new phone, I was worried about my wig interfering, turning my phone on. Heather has a good question. Is there something specific that can cause constipation in my baby? My 2-month-old has a hard time going poo, and I am wondering if it could possibly be my diet.
Did she say that she's breastfeeding?
It's a 2-month-old, but she didn't specify one way or the other.
Okay. I'm going to assume she's breastfeeding if she left the question for us here.
Yeah.
So here's the thing, and this whole thing has come up in my private group over and over again the past couple of weeks as well. In fact, I wonder if that's a question from there. The idea that your breastfed baby is constipated because they're not pooing as frequently as they were is wrong, is a misconception of how often they're supposed to go. Okay, so in the beginning, like the first few weeks, yes, they're going to poo pretty much every time you feed them. In fact, usually while you're feeding them is when it's coming out the other end. And it's actually the body doing what it's supposed to do. The milk going in, I don't know if you know this, Jamie, but the milk going in actually stimulates the intestine to release out what's in it. So it's actually, there's a reason why they poop while they eat.
It's like when you have coffee.
Exactly. It's actually stronger than that. Okay. Yeah, similar to that. Similar, very similar. And I know that feeling. Yes. But they eventually over time, what happens is, especially as the baby keeps growing, breastfed babies do not have to poop every day. And sometimes they can go days and days and days and even up to a week or more without.
I didn't know this until Grayson.
Without pooping, and it's totally normal. They're just utilizing everything. The breast milk is so utilized, every part of it. They're just using all of it, and they're not needing to poop. They do need to pee, and you do need to watch those wet diapers and make sure that you're getting 6 to 8 wet diapers in a 24-hour period. But the poop could really slow down, and I see so many parents like really stress over this, like to the point where they're like, giving the baby prune juice and getting all these like ideas from even the pediatricians telling them to do this or do that, or sticking thermometers in. You do not need to do any of that. In fact, when it comes to a baby, the constipation is not really identified by how frequently they're going, but by the consistency of the poop when it finally comes out. And so as long as your breastfed baby, even if they haven't gone for 7-8 days, when it finally does come, and watch out, because when they wait that long, it's like an explosion everywhere. It will be soft and yellow and mustardy, and it should be that normal breast milk consistency. If you've got a baby with hard stool, then obviously that's a problem. That could be dehydration or other issues you want to talk to your pediatrician about. But if it's just literally the frequency, I wouldn't worry at all. Leave them alone. Keep feeding them. As long as everything else looks fine, it probably is.
Yeah.
How many of you guys have had your babies go days and days without a poop? I see them starting to post here, like, yeah.
Days. We didn't know this. And so like with Grayson, Grayson would eat, and Jennifer would be like, he hasn't pooped in a couple days. What's going on? So I think I actually texted you about it.
Yeah.
We did that a lot. And it was like, it's totally normal. And that doesn't mean, like, at one point he did have an issue and he was constipated. So we got a little windy, and gave him a little stimulation back there.
And it works, but doesn't always work. So I don't want people to go to extreme measures. And to me, an extreme measure would be to give the baby water or give the baby juice or anything else, or medications, suppositories, things like that. That's extreme, and that's completely unnecessary.
A suppository?
I've seen things posted that I want to jump through the screen. So yeah, just be very careful with your little ones, and understand what's normal. Rebecca and I did our breast sleeping Q&A on Wednesday, and we talked all about the fact that so much of when her and I get together to do our Q&As, it's so much about explaining the norm, like explaining normal, because that's really the biggest issue that most moms and dads have, is just not knowing the range of normal. And if you understood what was normal, so many of the stresses and worries about your little one would be alleviated, because you'd say, okay, well, it's normal, even though the opposite might even be normal. Like pooping every hour might be normal, while not pooping at all is also normal. And that's the range of normal that can be really confusing. And that causes stress. And then you think it's not normal, so you feel like you got to do something about it.
I think that would be a very interesting series for somebody to do. Like, what is the scope of normalcy with all of this? And like,
huge range.
Huge. It's a huge gray area.
It really is. And it would alleviate like 90% of the questions that we get. It would alleviate, 90% of the issues that parents think they have. And then the worst part of it all is, not only do they think they have an issue, but they start to react to it, or they start to try to fix it. And the fixing itself is the thing that causes the problem that they never had in the first place. And so much of that has to do with like feeding formula or supplementing or whatever it is, when you think you're not making enough. And the truth is, if you understood normal and you understood the quantity that babies eat, or what to look for to see that they're satisfied, or how much a breastfed baby really eats over the course of a year at each feeding, or how much is a breastfed baby supposed to gain as far as weight that has been told to them that it's a lot more than it is. All those things, if they knew the normal, it would answer all the questions in most cases.
I was trying, actually, because there were quite a few babies at this wedding last weekend and people with kids. So I had to answer questions about some things. That's like never any time off, but whatever, it's fine.
I kind of have the same issue going on, but it's okay.
It's like, once people know what you do for a living, and they're like, oh, blah, 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 and it's fine.
Oh, yeah.
Fine.
Oh, yeah.
But we were talking about, somebody's like, well, my baby's only in the 86th percentile. I'm like, what is this and this and this? And it's just like, are they peeing? Are they gaining weight?
Yeah.
Are they happy? Yeah. Is it good? Are they all right?
Yeah.
You're fine.
Yeah. Well, it's so true. We've gotten away for so long to help parents and support them to follow their own instincts and to look at the baby. Like if the baby's not doing well, you'll know. To have a healthy baby that's meeting all their milestones and they're happy and they have bright eyes and they have rolls of fat on their arms and thighs, and to talk to them and have them say, baby's not getting fast enough for the pediatrician's liking. And it's like, look at your baby. Not all people grow at the same rate. And it's very, very important for you to like look at your baby, follow those gut instincts. Most of the time when I ask a mom, well, how do you feel? Do you feel like they're doing all right? The answer is like, yeah, that's what's confusing me so much. Start to follow those instincts and learn what is normal.
Yeah. Go with your gut.
Mm-hmm.
Inez has a question. How can you breastfeed if baby has a tongue tie and your insurance won't cover correction?
This is the problem with insurance. It's a problem with certain things that are real issues that are not recognized as real issues, and tongue tie is one of them. How do I answer this question other than some things are important to address, even if you have to find a way to pay for them to happen, because you can't fight the insurance companies in most cases. I would actually recommend that you do fight the insurance company on this one. That would be about going to a specialist who would back you up on this and write some letters of medical necessity, because this is not a cosmetic issue. This is not a unreal issue. It's an absolutely real issue. It's not just about breastfeeding. And so often with tongue ties, many will say that it is just about, well, maybe they won't be able to breastfeed as well, so then give them formula, just pump and use a bottle. But it's not.
It affects everything from here on.
Everything. It affects everything. Breastfeeding is where tethered oral tissues or tongue ties, lip ties, buccal ties, it's only the first place it shows up. It's not where it ends. And so when a baby has a tongue tie or a lip tie, and usually they don't have lip ties without tongue ties, so it usually goes together, they need that correction, especially if the baby's oh, I lost Jamie. What happened? Okay, wait. You got kicked out. I don't know what happened.
Are y'all there?
Yeah, I'm back. You're back. I don't know. All of a sudden, everybody wanted to. I think it was just they wanted to see my full, studio.
Whatever.
I don't know what happened, but you were right there. At least you didn't get kicked off.
Technology.
You were in the green room. I could see you there. Anyway, what was I even saying?
Tethered oral tissue.
Tethered oral tissues. So it causes so many different things. It can cause a difficult latch. It can cause sore, painful nipples. It can lead to decreased milk supply. And then eventually it could cause the baby to be extremely gassy. They end up on medications for reflux when really all it's just about a latch that's having them swallow more air than they should be. Even if you're having no issues with your milk supply in the beginning or pain, if that tie is there, it could catch up with you later where all of a sudden the milk supply just drops off. And then later it can cause issues with feeding solid foods. It could cause issues with speech issues. It causes apnea later in life. It's one of these things that, unfortunately, the medical community hasn't quite caught up with what's going on. And it's not an uncommon situation. And I know, just looking at the audience here, I know there's a bunch of people here in the audience, because I know who they are here, who've had this with their children. And so I guess I can answer the question. If it was me and my baby had a tongue or lip tie and insurance wouldn't cover it, I would start by getting the letter of medical necessity and appeal to the insurance company, have the doctor appeal to the insurance company. And in the very least, if you cannot get them to cover it, then talk to the doctor about some kind of a payment plan and just pay it off over time and do the procedure anyway, because it's not just about switching to formula.
Yeah.
Mm-hmm.
So I'm trying to scroll through some of these because there's a lot of really good.
Can we talk about the pump for a moment?
Well, that's what there's a question that kind of ties into that, and then it'll be a very good segue. So Katie has a question. I'm a second time working nursing pumping mama. I'm struggling with milk extraction. I have a pump and use the smallest flange I can find, and they seem to fit decently, though probably still a bit large. I am able to stimulate a letdown, but rarely get more than a ½ ounce from each breast. I have tried just about every combo of pump speed and suction that is comfortable with little change. I go on to hand express at least another ounce or two from each. This is quite frustrating and time consuming. Suggestions? Thank you. Heart, heart, heart.
Mm-hmm. And you said this is not an Evenflo pump, right?
No.
It's an interesting thing because, when we look at the features of an Evenflo pump, and I'm going to bring this up here because I think when I'm listening to the question, I kind of have an idea of what might be happening. The fact that she's using the smallest flange possible, and she still thinks, right, that she needs a smaller one than that. It's very uncommon. I mean, I'm not saying it's not possible. It's possible.
A 22 millimeter.
Yeah, to be smaller than a 22 and really have that impacting how much you can actually get out with the pump. So first, it may not be the flange at all that's doing it. It may be the pump. So she's thinking the flange is the problem when it could be just the pump itself that's the problem, that she can't get milk out. She's hand expressing plenty. So there's something wrong with her getting the milk out with this particular pump. But most pumps on the market have a hard flange, okay? Mm-hmm. That really hard plastic flange. Do you have the pump there?
Yep, okay. Of course I do.
So most pumps have the hard plastic flange, and the flange is the piece right there that goes up against your breast. With a hard plastic flange, okay? Now this is where we put the insert. With the Evenflo, you put the soft silicone insert inside of it. But if your pump only comes with the hard plastic flanges, which the majority of them on the market do, if you, depending on your breast tissue, some people have like more elastic tissue, okay, where more of the breast tissue is being pulled into the flange because the tissue is more elastic. And that can happen, especially as you go through the year and the breasts are not as full as they were, or maybe you've nursed several children. So you're going to know if I'm talking to you, you know exactly what I'm talking about. The breast is just more elastic. And what winds up happening that I see is that with the hard plastic flanges, more breast tissue is pulled into that flange. That's the moms who will say to me, I can't get a flange that's small enough. Like no matter what flange I have, too much of the areola, too much of the breast tissue is being sucked into the flange. I can't express milk. So that's really more of an issue with the hard plastic being slippery and not holding that elastic breast back.
Yeah.
So what I found with the flange on the Evenflo, and I've had several, I'm talking at least a half a dozen moms who've reached out to me directly about this particular issue, have them switch to the Evenflo pump that has this soft silicone flange. And as you can see, I don't know if you could see it, bring it a little closer to the camera, Jamie. See how it's soft right there, and that silicone on the inside where there's like a flower feeling, that's a texture that allows the nipple to slide in and out so there's no friction. But the outer rim is a little more sticky, like silicone.
Sticky.
Yeah, it's sticky. So what happens is on a breast that is elastic, you put your breast up to that, the breast tissue is held in place while the nipple is allowed to move in and out of the flange, and the whole breast is not pulled into that flange. And so that stickiness of holding the breast in place makes all the difference. And we find that they don't even need a 22 altogether. They needed like a 24, 20. They actually needed a bigger one. But they needed the flange itself to hold back the tissue. And I don't know if any of you guys have ever had that happen to you or experiencing that right now, if that made sense of what I just said. But that's usually the problem when you're saying to me, I need smaller than a 22. The second thing would be that you may not know how to stimulate the milk to come down. You're doing it with hand expression, but are you able to use that particular pump to stimulate multiple letdowns? And it might be that just that one letdown that you're getting with that pump is a half an ounce, and there you go. And then there's no way to adjust it the way I teach to adjust it and get those multiple letdowns with that pump. So it could be the flange, and it can also be the pump itself and the suction and speed dials. And are you able to get multiple letdowns? Should we show them the features? Because I just went over two of the features on the pump.
No.
So, yeah. Do you want to do a video?
We can do that, or I will do a video.
Or what?
I will be your video, or we can do a video.
All right. So let's do
your decision.
Okay. Well, let's do it live.
Okay.
Okay. So, and if you guys know this here, all right? So many of you have this pump and you know the features, and I go over these features because they're so critically important.
Mary, guess what? Guess what I just found out on Facebook today? They've added something. I don't know if I can do it from my phone, but the next time you go live from your browser on your computer, you can actually have a poll on your Facebook Live and have people respond in real time.
That's awesome. That's awesome. That's what we need, because it's so hard to, we want to know what's going on. It's great to ask you guys questions and know what you're saying, but it is hard when we're doing the Q&A and trying to read all the questions that are scrolling by pretty fast.
Yeah. So I'm very into this idea of a poll.
Yeah, totally. I love that idea. I wonder if it works on Be Live.
Nope.
No. All right. Anyway, so this is the Evenflo Advanced, and this is the Hush model, which is brand new, and it's just a quieter version of the amazing Advanced Double Electric Pump. You know, everything can be improved always, and Evenflo always listens to feedback. So they wanted a quieter version. Now you got it. All right. This is the Hush. So when it comes to the features of your pump, the most important features are the ones I'm going to go over right now, because these are the ones that I look for when I'm recommending a breast pump. And as I told you in the beginning of the show, if you missed it, I was involved in the design of this pump and coming up with some of these features that's why it has everything that I like and why I recommend it, because it does have everything.
Is my wig throwing you?
What?
Is my wig throwing you?
I've started.
Mikey's just back here.
But you had to go bring my attention back to.
Mikey's just back here hiding behind phalanges, like it's no big deal.
I have gotten used to it, and now you just brought my attention back.
Oh, man.
Oh my God, you're the best. You help. This is the best because I get to laugh the whole time, Jamie. You get me happy. Just don't
have fun with
I
this.
have the best job. I really do have the best job.
We have a good time. We're very lucky.
All right. So features on the pump. Anyway, first feature, we just talked about it. It's the flanges. Okay. And the flanges, the breast pump comes with 3 sizes included in the pump. And that's huge because you don't know what size you need really until you try them out and see what works best. And sometimes that flange size changes over time throughout the year that you're breastfeeding. And so you want to be able to have the right one so that you can express the milk as fast as you can and as easily as you can. Sometimes you need one on one side, another size on the other side. So having those included, even in the most basic model of the pump, is super important. The other part was what we just talked about as well, is that soft silicone flange. All the rest of the pumps, almost all of them on the market, come with the hard plastic. So not only if you have that issue that I just said, but that'll be a problem, but also just the comfort. And we all know that comfort is most important when pumping. Pain, any kind of pain during pumping is going to inhibit that letdown reflex. And so you won't get milk out. So being really comfortable is super important. And the soft silicone it creates like an air cushion. So it's very, very comfortable massaging feeling on the breast. And then Jamie just turned the flange to the side there because what he's showing and demonstrating is that the flange is angled in a way that makes it so that you don't have to lean over when you're pumping. And I know you guys, anyone who's pumping, if you're using another pump, and I see some of you guys are, you know what I'm talking about. With the pump that you have,
like this,
you got to lean over so that the milk is not backflowing onto your breast and then breaking the seal. Okay. So what we did was we designed the flange so that it's angled enough for you to sit back, and they're what we call slouch-free pumping. All right, so you're not having to lean over. Doing that for hours, many times a day, leaning over to pump will be a big strain on your neck and on your back. So I think it's one of the most important features here to keep your comfort. Is that sit back flange. Okay, yeah, they're saying yes, horrible. Yeah, this is the thing. Moms who are pregnant, who are looking at different things, of different features, different breast pumps, and we all know there's lots of choices out there, they don't know necessarily to look for that until they're using it. And that's why I love talking about this stuff, because you don't think of that being such a big deal, but when you're using it every day and you have to lean over to get it to work, it's a pain. And you think, oh, I wish I would have known about this beforehand, right?
It's one of those things, like whenever we do these, it's like, a lot of people have questions, obviously, but they don't even know where to begin with questions or what to ask.
Yeah.
And this is one of those things, like you would never think about an angled flange, or even like I have them both in the bottle holders here. Like the fact that there are bottle holders built into the back of this pump. So if you're pumping at night or whatever, and you can put them in there and not worry about spilling your milk out, it's something you wouldn't think about needing until you need it.
No, the bottle holders are awesome. There's 2 of them, like duh, there should be, right? 2 bottle holders that actually hold the bottles really tightly.
Very
Not
tight.
not too tight where you can't get it in, but just tight enough to really support you and support your milk so you don't spill it. All right. So the footprint of the whole pump is nice and small. You could, if you don't have a lot of space at work, it's easy to take it out and have it right there on your desk or on your night table at night and not take up too much room. It's lightweight and really portable, which I love. You know, I can't imagine a really big pump in a bag or like trying to maneuver with that. You know, not only is it small and have those bottle holders, but it also takes batteries, which makes it even more portable. So it's lightweight and it's portable and convenient, but then it's got other features that are really needed, which is the fact that it is a closed system. And so many people really know about. When we started doing these Q&As, Jamie, like no one knew what a closed system is. And I'm so happy when I see conversations now, like everybody kind of knows closed system and what to look for. You want to show them what a closed system is?
Yeah, and I even see this at Gearopaloozas, my gigs all over, because I always ask when we talk about breast pumps, how many of you know the difference between open versus closed system? And it has been a slow process. Like there's still a lot of education to be done, but the number of people that know the difference has gone up drastically since you know, the past 3, 4, 5 years. So this is great. So the closed system means that there's this little membrane, like a barrier right here, and then you would snap that on. So the air and suction is happening here. Milk is going bloop, bloop, bloop down here through the membrane, and then it is not possible for it to back up into this tube and back up into the motor. So it keeps your tube completely clean. It keeps bacteria from growing, keeps mold from getting in your motor, and that is a problem with other pumps. And so closed system, I think you and I both agree, like when you're kind of like the hierarchy of breast pump features, that's number one.
It really is. It's number one. And, you know, there's been a little confusion, a little bit of like, you know, is it closed? What does it really mean to be closed? I'm going to be really straight with you guys. Closed means that there is a barrier at that point where the tubing hits the flange and you can never see condensation in that tube. So I don't care if it says, oh, there is a barrier going to the pump. Not enough. You need it for the tube. I don't care if it says it's closed and you're seeing condensation in the tube. That means it's not sealed properly. So there's a lot of claims going on. But I want you to be really careful about what you look for, because obviously now closed system has become a big concern and issue. And there are many pumps that, you know, don't have that feature. I want you to be careful with that one, especially because it's a hygiene issue. Plus, it's going to be a pain in the butt to keep cleaning those tubes the proper way. And sometimes it's really impossible to do. It's really impossible to do. Last thing would be the speed and suction controls on the pump. And that's what we were talking about before with getting multiple letdowns of milk. Being able to control your speed and suction independently allows you to be in control so that you're not just pushing a button. It's not doing it for you. You know, it's really important for you to be able to control it from feeding to feeding and to know what numbers you have. Like, at what number do you let down the first time? At what number do you let down the second time? You'll understand that it's really not that complicated. And I have a 3-stage pumping video that I show that really goes over how to use the speed and suction controls that will help you to get more milk out. It will help to drain the breast. It's like what the baby does when the baby's nursing at the breast. The baby is stimulating multiple letdowns. They just do it instinctively. They know what to do. So if we can just copy what the baby does as much as possible with your speed and suction controls, then you're going to have the easiest time getting the milk out. Yeah. And then they also come with my classes too. So
Yes,
not only simply breastfeeding, but also breast pumps and briefcases, which is a full-length class that teaches you everything you need to know about pumping and going back to work and childcare and all those important things so you can make that transition nice and smooth. Okay, and so it comes with the classes as well. And they're available too. Jamie, you know what? In the links that I gave everyone, that link that's in the post that they can go to, there's There's links there to go to the insurance locator because this pump is covered by insurance, so you can get it through the your DME. There's a locator that'll have you put your insurance and your state in, and you can find the pump through insurance. It's fully covered for most people. And then you can also get the pump at Target, at Walmart, Buy My Baby, Amazon. You can get them in lots of different places, and they're affordable.
They're under $100.
Mm-hmm. And really, and if you touch this pump, you'll see the quality of this pump is really awesome.
Yep.
Mm-hmm.
Very, 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 very good.
Yeah.
I was pulling up another question on my phone. Kayla, I'll move this out of the way.
But now I can see more of you in your costume, and I'm getting.
Listen, I got the key right here. I got it all. And the best thing about this, they built this to be a bottle opener.
That is perfect.
So, happy Halloween.
Happy Halloween.
I'm struggling with breast pain, Kayla, not me. I have been treated for ductal thrush, but nothing seems to be helping. I have also decreased my supply from donating 50 ounces a day in hopes to relieve the pain. It's not a latch issue. This is my 4th EBF baby, and I had the pain when exclusively pumping the one side. There are no symptoms of thrush in my baby, but I'm absolutely at a loss with what I can look into next. I've never been so disheartened feeding a baby before. The pain is really messing with my head. And all over breast pain that feels like a deep bruise that won't go away. Help.
Thrushes can be nasty. Thrush is like it's a fungal yeast infection in the breast. Different than the yeast infections that women can get vaginally, but it's the same type of organism that does it. And it can be, from what she's describing, it's not abnormal to feel that much pain and feel that, exhausted by the whole thing. The baby doesn't have to have signs in their mouth, although they can when you have thrush. But typically thrush will present with very bright, sore nipples, like bright pink, red hot, and sore without any cracking or bleeding, like as if it's coming from latch issues. Okay. So you're like, why do they hurt so much? And it doesn't always happen right away. So you could have a period of time in the beginning where everything's fine. And then all of a sudden you have this nipple pain for no obvious reason. And then the other thing she's describing is that soreness in her breast. And usually it's like a sharp shooting pain that you'll feel within the breast tissue, usually between feedings, not even during the feeding, but between. So having nothing to do with the latch or the baby eating. I would say this, the strains of Candida or yeast that we see have become more and more resistant, like all the other stuff that's out there, to the treatment. So, just like bacterial infections are more resistant to antibiotics, we all know those things are happening. Similarly to the fungal infections as well. And so often yeast infections in the breast are not treated as aggressively as they need to be. So either there's just not a lot of understanding and information, either from your physician or whoever you're talking to about it, of how that needs to be treated. Usually if you have pain within the breast tissue, it's not enough to just be topically treating it or doing some over-the-counter stuff. That's not going to be enough. And it usually requires oral medication. The drug of choice is usually diflucan. Diflucan to treat vaginal yeast is a one-time dose. Diflucan to treat breast yeast is usually 2 weeks worth, or sometimes up to 4 weeks. You could be taking it for a whole month. So you can imagine if you're talking to your gynecologist or your obstetrician and they're used to treating vaginal yeast infections with diflucan, and you come in and say, I'd like to take the diflucan, they're going to give you a one-time dose. That's not going to do anything. And sometimes even 2 weeks worth won't do enough, and it'll come back and you might need to be treated again. So I would do a little Google searching, a little reading. Okay. Good place to learn about the treatment. Dr. Jack Newman, he's great. And he has some really great information. I would look that up online, do a little reading. I have an entire course on plug ducts, mastitis, and yeast infection, where I go over this as well, that you can find that through my website as well. But find out what you need to do, because you probably need more aggressive treatment at this point. And there's also other things that you can do to help, minimize it. Like you want to avoid sugars. You want to make sure that you're washing your pump parts. You're actually boiling them and sterilizing them each time. You don't want any pumped milk that you pumped while you have a yeast infection. You don't want to save it. You really do want to get rid of it, because if you're treating yourself, it can reinfect the baby again. All those things your bras need to be washed in hot water and really disinfected. So you can keep recontaminating yourself, and it can be hard to treat, but it is doable. People have gotten through this. I had it. I personally had it with my first baby. And it took a month. I mean, I did 2 weeks of the medication, and then I had to do another 2 weeks just to get rid of it. But it was the worst part. It was very painful. The milk is not contaminated as far as, while you're going through the treatment. And here's the thing to say about this. And, we talk about medications and breastfeeding all the time. And diflucan, if anybody's like concerned, maybe the baby shouldn't have diflucan, most medications are completely safe for breastfeeding. Most, okay, there are a few exceptions, but they're rare. Diflucan is not one of those that are contraindicated. And in fact, diflucan is a drug that they give to preemies, NICU babies, okay, in the NICU directly, in doses that are larger than what they're getting when it comes through the milk. And to me, the risk of you discontinuing breastfeeding is way higher than the risk of the child getting diflucan through the milk for 2 weeks or even a month. Most likely the baby has it anyway without any of the symptoms, so they need the treatment as well. And so those little amounts of diflucan can only help. So this is, again, unfortunately, breastfeeding as a medical field is way misunderstood. Not enough research and not enough well-trained practitioners out there to do this. As a lactation, I'm a midwife and a lactation consultant. So the little bit of difference in that is, as a lactation consultant, we can't diagnose or treat, meaning we can't write you those prescriptions. We can't diagnose you. We can evaluate you and refer you to your physician or midwife for treatment and diagnosis. The difference with me is, obviously, being a midwife, I was able to diagnose and treat as well. And so my patients did well because it was all taken care of at one time. But for many of you, you need to find a midwife or a physician who is up to date or at least open to listening to the lactation consultant who could hopefully guide you through some of these problems.
Man, I just don't even like obviously thrush, I don't have a huge understanding about, because we don't talk about it that frequently. Obviously I know about mastitis and the boob flu and all that, and cracked nipples, and none of it sounds appealing.
No.
But thrush just sounds like a different level of pain.
It's a different level of pain. It feels so unexplainable. It feels like, why? Like the nipple's intact, but why does it hurt? The breast, the baby's not nursing. Why am I in so much pain? I've taken the treatment. I've taken the medicine. Why isn't it going away? So it's all of those things compounded. And I guess a couple things you want to know so that is what it feels like that we just talked about, but also what predisposes you to thrush. Anybody who's received antibiotic treatment is predisposed to thrush. So if you're somebody who received antibiotics during your pregnancy, or if you're somebody who received antibiotics, like IV antibiotics during labor, that would be anyone with a C-section. If you were group B strep positive and you received antibiotics, or you had prolonged rupture of membranes or any kind of fever in labor, you're going to get those IV antibiotics, and the antibiotics not necessarily going to cause thrush, but it will predispose you to it. So you want to be on top of it. Taking a probiotic every day, okay? Taking those good probiotics, especially if you've had antibiotics, is going to help. So I definitely would recommend that. But, avoiding sugars. Sugar is what feeds the yeast. And so during your treatment, you really need to avoid and eliminate sugars, no fruit juice, none of that stuff, okay? Again, washing your parts frequently. It's one of those things that if you learn about it, you can hopefully prevent it. And then at the very least, diagnose it properly and get the right treatment. But don't give up. It's also a really common thing. You know what I mean?
Yeah.
It's like one of those things that, it sucks, but it still works and it does go away.
That just sounds unfortunate. Ugh.
Yeah.
Oof. Well, we've been going for over an hour now.
Oh, wow. I didn't even
With
look.
only barely over an hour, and we only had one little technical glitch, which is
It was
very
not bad at all. It was not. It gave everybody a chance to see my full studio.
And I'm in a wig.
And you're in a wig. Hey, I wanted to just say something. Somebody said that the links weren't working. The links should be working, but in the post, in the post. Okay, you can't use the links that are being posted here in the chat. That doesn't work. You can't click through on the links here in the chat. You have to use the link that's in the post.
Because it operates through Facebook Messenger.
Mm-hmm.
Yeah.
Well, any links. I don't think you can post any links into the chat that you can click through.
In the chat, you can. I post links in the chat. Maybe they're just not working right now.
After the stream or during? I don't know. Maybe I'm wrong. It used to be that you couldn't click through the links during the chat. It
could also just be Facebook being crazy today. We just never know. You never know with Facebook.
It's the bit.ly link. It's the bit.ly link that says Evenflo pump giveaway. So you want to click on that so that you're entered to win the pump and get all the links from today's show.
Do I have a crease? That's the worst thing because my head is so big.
And you know what?
My head is so big. Every time I have to wear hats or wigs, which is not frequently, thank goodness, I get this crease, perma crease in my head. Awful.
You know what? I know you're gonna have fun on Halloween, but I'm glad it's only one day because I like the way you look like that.
I don't like this wig. I couldn't cut it. I couldn't cut it. Like
it definitely is funny.
It also just itches. It really itches something terrible. So I'm gonna have to do things to counteract that. So
oh, Stephanie's saying on my behalf, if you see me posting during the stream, I'm not. It's Stephanie here doing it for me. She's saying that the links work on a computer. They don't work during the stream on mobile.
Oh yeah. On a mobile, they won't during the stream.
Okay,
and most people do watch these on mobile.
Yeah.
I want to say on my page, it's anywhere from like 85 to 90% is mobile use.
It's the same for me too. It's the same for me too. So if you're on mobile and you can't click the links that are here in the stream, just go to the post.
Yeah.
When we're here, it'll be right in the post.
Yeah, once we're done, it'll all be uploaded and you can click the link. So you'll be able to get all the information. I want to thank you all for hanging out on this Friday afternoon. Shari, it is good to see your face.
Good to see your face too. Miss you, buddy.
After way too long.
I know. And I won't be in LA with you next week. Boo-hoo.
I'm coming up to New York in November though.
Oh yeah?
Yeah.
Okay. Well, I'm going to be away for a few days, so make sure it's when I'm not here.
Okay.
Make sure it's when I'm here. That's what I mean.
Whatever. I'm coming up when I'm done with Gearapaloozas in the middle of the month. I'm coming up right after.
Okay.
Because next month I am turning 40. And so I'm traveling all around my birthday. So I'm going to have a little birthday party in LA when I'm there next weekend.
Awesome.
I'm going to have a birthday party here in Denver. I'm going to have a birthday shenanigan in Minneapolis with some friends and sisters. I'm going to have a birthday shenanigan in Chicago the next day. And then I'm going to go to New York and have birthday shenanigans there.
Well, I think come stay with me. And we're both having huge birthdays within the next 2 months. I'm not going to say what mine is. But
30.
30, exactly. We're both having huge birthdays coming up. So I think we need to celebrate our huge birthdays together, at least a little.
It'll be Vuv.
Mm-hmm. All right, you'll tell me when.
Great.
For sure.
Awesome. And also, thank you, Evenflo.
Thank you, Evenflo.
I was actually, digging up some back end stuff for them the other day on like my platform and everything. And I've gone over every kind of post and video for the entire year. And when you add up the reach and the amount of people that are seeing this information, it is staggering how many people have access to this. So it makes me very happy. And I just think it's great. And this is use the platform for good.
It's so great. I love doing it. I'll keep doing this with you for as long as I can.
Yep.
Awesome. And come join me in my private group. There's so many. We have so many great moms. They're all over the world, thousands of them, and just great questions. They're very engaged. Lots and lots of posts going on, but just some really great advice. And if you guys, felt like you had some good advice today, you need more, it's a good place to do that in between our Q&As here.
Yeah.
Mm-hmm.
Awesome.
That's it.
Well, thank y'all. And let's do this in person next month.
All right, well, come visit me.
Yeah, I will.
Come visit me. I'm here. I'm ready for it.
I will leave my costume at home.
Good. I love it. I'm sorry.
I think it's great. It came with so many props. There's a map. There's all kinds of things. I just didn't bring them all out. $20. So many props.
Take lots of pictures and send them to me.
Oh, I will. This rain jacket, it basically has the texture of a garbage bag or something. It's very high quality. So it may not make it through the night. You just never know.
Hopefully it won't. It will. You'll have too much fun.
I may not make it through the night either. So
you might not miss the raincoat.
Thank you all for hanging out. I will see you all later. I'm going to go get lunch now.
Okay. Bye, everyone.